Episode 242, The Price We Pay. What broke American healthcare and how to fix it. Today, I speak with Marty Makary, MD.
American healthcare entrepreneurs and executives you want to know. Talking. Relentlessly seeking value.
Today, I speak with Dr. Marty Makary about his new book, which is entitled The Price We Pay: What Broke American Healthcare and How to Fix It. I could not recommend this book more highly. It's a page-turner for hospital execs trying to do the right thing, employers trying to do right by their employees, insurance carriers looking for better ways to actually drive healthcare value, and doctors and nurses who are feeling burnout because they see their organizations demanding them to do things misaligned with their mission to do the best they can by patients. Dr. Makary tells me in this interview that his intent with this book was to shine light on some of the issues, mainly around the price we, as patients, taxpayers, employers, basically all of us, pay. Dr. Makary says that understanding the situation is the first step toward navigating and redressing it. The Price We Pay gives multiple examples of egregious pricing. I'm going to split these examples into two categories. First, your basic price gouging, including surprise billing and what amounts to predatory pricing done at scale. The second category are high total prices because the services rendered were some shade of unnecessary. So high prices based on the price of the unit, and then high prices based on the number of units delivered. Dr. Makary and I talk about both challenges today. We also talk about the multiple instances where doctors and nurses and others are doing the right thing and really working hard to correct issues. Their efforts are glimmers of hope for all of us working hard to do right by patients. My name is Stacey Richter, and this podcast is sponsored by Aventria Health Group. Dr. Marty Makary, welcome to Relentless Health Value.
Great to be with you, Stacey.
So let's talk about your new book, which is called The Price We Pay: What Broke American Healthcare and How to Fix It. And the book gives multiple examples of egregious pricing. Are we talking about outliers here, or is this pervasive?
Most doctors and hospitals try to do the right thing and serve their communities. But if there's been one trend in the last 5 to 10 years, it's been the massive growth of surprise bills, of overinflated bills. You know, the reason these bills are often overinflated, Stacey, is that hospitals have said, we just need negotiating leverage with insurance companies. So we want to give them a big discount for their customers. By inflating the prices, the discounts look big. And so it's been this game. It's been an insider game. And many times when we've presented these big bills back to hospital CEOs, they'll often tell us, and the advocacy group that I'm working with, the students with Restoring Medicine, they'll often tell us, look, nobody pays those bills. Nobody is responsible for paying these highly marked up bills. So we basically took them to task and said, okay, let's do some formal research, just as we do formal cancer research and public health research. And let's ask the question, are Americans responsible for paying these marked up sticker price bills? And the reality is a ton of people are being shaken down for these bills, not just the uninsured, but those receiving out-of-network care, even at in-network facilities, those with high deductibles. You look at most Americans, they have less than $400 of cash in savings to their name. So when they get hit with a $6,000 bill or even a $4,000 bill, it can be catastrophic to that family. So I, in the book, The Price We Pay, decided to take 2 years, tour the United States and talk to every stakeholder in healthcare, drug companies, middlemen, hospital executives, nurses, doctors, frontline people, and patients. And what I learned is that a lot of people in healthcare are doing very well. We have tens of thousands of new millionaires that have been created who are non-patient facing in healthcare. And that's okay. We need good managers. But the damage has really been done to the hardworking American family or individual that has a job, has insurance, but is really getting screwed by the money games right now. So I don't know if you saw the movie The Big Short.
Yep.
I mean, I don't know what you thought of that. I loved that movie. I just thought it broke down a complex subject so well and made it entertaining. That's what I wanted to do with the book, The Price We Pay. I wanted to explain the complexities of the business of medicine so any person could understand exactly how it works. So it's not a nebulous cloud, because that cloud was part of the mirage of the banking industry. That cloud is one of the reasons why the money games in the banking industry continued to go on with very little public accountability, because the argument was, look, these are very complex banking instruments and systems. You have to leave it to us, the experts. Well, guess what? It wasn't that complicated. They were spending our money, spending money they didn't have. They were spending borrowed money. Anybody can understand it. And that movie, The Big Short, explained it. And the same thing needs to be done with healthcare today. There are money games. If you break it down to any person, it doesn't matter what political party they are, whether or not they work in healthcare or outside, whether or not they're a hospital CEO or they're a mechanic taking care of the ambulances, they will tell you this is not right. And I think doctors and nurses have suspected for a long time, our system was never intended to be this predatory, to have this much price gouging, to have this many money games in the system. And, the subject can be very depressing. So what I did is to try to really identify all the bright spots, all the positives, all the innovators, all the disruptors that are really challenging the status quo and succeeding because of it, because there's tremendous demand, I believe, right now for honesty in healthcare.
Personally, I found the book a page turner. There's so many very impactful and very interesting examples. But what you said about The Big Short, drawing that parallel, really strikes a chord because, as many have said, healthcare is very not transparent, the opposite of. And as any number of behavioral economists, including Daniel Kahneman, have said, under the cover of darkness, people do things which they might not do if people could see into the closed door meeting, which there are gag clauses in certain cases to even prevent that complexity from being revealed. And I think one of the quotes from the book, which really struck home with me relative to predatory pricing, is the billing clerk who said, in quotes, "We can charge someone out of network as much as we want. The law says we can."
I tried to identify in the book, The Price We Pay, both the really positive stories and the egregious stories. And so there are hospitals that I highlight that are doing a terrific job serving their communities with fair billing practices and are very forgiving and merciful to their patients. And then we saw the opposite, right? We saw hospitals doing price gouging routinely, predatory billing, sort of gotcha, small print, asking patients to sign their financial life away when they come in sick to the emergency room. Look, hospitals were created in America as a safe haven for the sick and injured. Okay, many were established with a charter founded by churches, with a charter to serve anyone regardless of quote unquote their race, creed, or ability to pay. This is the great heritage of medicine. Okay, this is what every doc and nurse should be proud of. We come from this lineage of taking care of people when they need us. And look at the people applying for the Johns Hopkins Medical School or any medical school. They're bright and creative and altruistic, and they want to help people, right? This is the incredible heritage of medicine. And unfortunately, that public trust is now being eroded by predatory pricing and unfair billing practices. And it's a disgrace. It's an anathema. It's a disgrace. And we found hospitals that routinely sue patients. In one town, the small hospital had sued half the town. I mean, healthcare was never designed to be that predatory and to take advantage of people. I believe it's basically taking advantage of people when they're sick and vulnerable.
Exactly what you just said, these kind of bad eggs that are spoiling the barrel, to mix metaphors there. The Edelman Trust Barometer showed the trust in hospitals nosediving 7 points this year. And it might very well be because of the spotlight that's being put on some of these bad practices from hospitals. But, something that you just said struck me. Every time anybody goes to an ER or is admitted to a hospital or even just goes to the doctor, there is that ubiquitous form that you're asked to sign. So if I am a doctor or a nurse or someone in administration, and I know that's going on at my hospital or practice or clinic, is there anything that I can do? It just feels like a tough situation to change at an individual level. What's your advice?
Look, I think we in healthcare need to speak up about this problem. I'm a surgeon. I get it. I believe doctors and hospitals need to be paid for their work. But I've got some colleagues who tell me, Marty, why are you working on all this stuff about hospital billing practices and the appropriateness of medical care? Don't you love being a surgeon? I mean, isn't that enough? And I tell them, look, I love being a surgeon, but a quarter of the public doesn't trust us right now. A quarter of Americans don't pick up their prescription for fear of the price of the drug. A quarter of Americans are worried about putting food on their table when they get a medical bill or when they seek medical care. If this is a barrier to getting people quality medical care, it doesn't matter if you cured cancer. If you can't give people that cure, if you can't deliver those state-of-the-art therapies, that public trust having been eroded is the frontier of delivering high-quality medical care in the United States. And for doctors, for nurse managers, for leaders, for hospital administrators who hear about this type of stuff and they say, this is a disgrace, this is an outrage, this is wrong, this is not who we are as a medical profession, talk to your hospital leaders, community, people in the concerned citizens. Find out who's on your hospital board and have a civil conversation with them. I get emails all the time of people who got an egregious medical bill. And I tell them, have a conversation with your hospital. You shouldn't have to be fighting with some call center representative that's out of town about a medical bill. These should be civil conversations. That's how any accountable business would work. I'm on the board of a large hospital system. The people on the board are often unaware of what's happening with the hospital's billing practices or with issues of appropriateness. Let them know. I mean, they are the sort of front people or liaisons to the community. So I say get to the people who are on the boards and the leadership and just tell them in a very polite way, this patient showed up for an emergency room visit, was charged $10,000. It seems egregious. Now the patient is being sued or they're being sent to collections or their FICA score is getting destroyed. This doesn't seem to be consistent with the hospital's mission statement. And can you look into this? If we all speak up, we can make changes. And in the book, The Price We Pay, I highlight many of the positives that are happening right now. And on the website, restoringmedicine.org, we put some tools for patients on both how to fight their medical bills, but also how to enact social change, right? We shouldn't be playing whack-a-mole with high bills. We should be talking about an honest and fair billing system.
Yeah, there's a quote from Dr. Keith Smith from Oklahoma that is in The Price We Pay. It's, how can we take an oath to treat a patient and then allow their lives to be ruined financially? And I thought that summed it up very well. If I'm on the board or I am an administrator in a hospital, what's your advice to me? I may or may not know that this is going on. Let's say I discover that in certain cases it is. How can I make myself accessible? Or how do I enable the physicians or the PCPs in the community who might be realizing that their patients are in this situation?
So I think these civil conversations are powerful. And believe it or not, most leaders in healthcare have no idea how bad things are and how ugly it looks on the ground. I'll meet hospital leaders that will give me a very rosy picture of how lenient they are and how generous with financial aid they can be and how they work with individuals, and a story of somebody where they gave them free care. And it sounds so rosy. And then what I'll find on the ground is an intense and relentless pursuit of patients to pay bills that they cannot afford, that are marked up bills, they're unfair bills, and sometimes they're for services that should have never been rendered or for services that represent complications that were avoidable. And so when we have these conversations, they're powerful. If I can, share something very personal, my own employer, Johns Hopkins Hospital, was one of the hospitals found to be suing patients. Now, it blew up, and I can tell you the leaders of the hospital the vast majority had no idea this was happening. When we've gone to hospitals in the United States, and Hopkins had cases of suing some people, but I'll tell you, we found cases in the United States where a hospital in Virginia, a hospital in New Mexico, sue the crap out of people. Okay, they're suing the crap out of people. And they've sued in one town 20,000 patients. The town only has 28,000 people in it by census data.
It's horrifying.
Right. And we asked the doctors, are you aware that the patients you're treating are getting sued in court to have their paycheck garnished for life almost sometimes? I mean, if you have a $12,000 bill, how long does it take to garnish a minimum wage paycheck to get that paid off? I mean, it takes sometimes the rest of the person's life. For a bill that's marked up 4 or 5 times what Medicare would pay for the same thing or what a commercial payer would pay, it's not right. So when we talk to the doctors, they have no idea and they're outraged. When we talk to the hospital leaders, many times they have no idea and many times they're outraged. So these conversations are powerful. I believe that billing quality should be a measure of medical quality. In other words, a hospital, a provider group should be evaluated not just by their medical complication rate, but by their billing complication rate. Financial toxicity is a medical complication. And we've talked to U.S. News and World Report. My team has talked with CMS and their 5-star rating system, health grades, you name it. Medical billing quality is medical quality. And we need to start evaluating hospitals so we have some accountability. Most hospitals do the right thing. And I think when we can appeal to the best in people, look, everybody who's in healthcare went into healthcare out of a deep sense of compassion. Hospital administrators, business leaders, doctors, nurses, physical therapists, you name it. We all went into medicine to help people in some way. And I think when we can show how ugly things are on the ground right now, how bad the public trust has been eroded by predatory billing and price gouging, how dishonest the practice can be of providing out-of-network care at in-network hospitals on an elective, non-urgent basis without ever telling a patient, without giving him any choices. Look, we can do better. We can restore honesty in healthcare, and I think that's really our great heritage.
Given that CEOs tend to, and doctors and leaders at provider organizations and board members are unaware of what's going on, how is this happening? Is it some rogue billing clerk or like the finance department just went off the rails? Like, how does this happen unbeknownst to leadership?
Yeah, so oftentimes the billing practices and the collection strategies fall under the CFO. And there's oftentimes 1 or 2 layers of outsourcing this to other agencies or companies or law firms. Now, language matters, Stacey. So if you're at a hospital and your CFO tells you that we recovered 23% of our bad debt, you think, oh, okay, that's a good report. 23% is above average for bad debt collection. When you call it bad debt, I believe we're mischaracterizing what it is. Okay, these are egregious, unfair, marked up bills, and the billing practices can be predatory, and shaking people down is inconsistent with the mission of medicine. So look, if you have plastic surgery and you're wealthy, you can go shake that patient down as much as you want. Okay, there should be a contract in place where they understood the price of the plastic surgery, and you can go after them. You can take them to court, for all I'm concerned. But these are low-income working people that don't qualify for government or local financial aid programs. They've done nothing wrong. Their deductibles are through the roof because healthcare costs have spiraled out of control. Insurance companies manage high costs by simply jacking up the deductible. And these are well-meaning people who have saved $2,500 so their son can go to college. And they get hit with these bills. So I'm on a hospital board, and I can tell you, I don't think anyone on the board knows how aggressive the hospital is with collecting bills. I think if we, instead of calling it bad debt, call it price gouging. Instead of calling it hospitals using legal action to collect bad debt, why don't we call it predatory billing? Instead of calling it hospitals recovering uncompensated care, why don't we call it patients being asked to pay prices for prices that were not disclosed to the patient at the point of care for non-urgent care? I literally hear stories of individuals begging the doctors in the hospitals and the leaders and the administrator on call, please, I want to know the price of this elective heart surgery. And it is a massive runaround. It's a circus. I don't think we got bad people who are diabolical and trying to hide the price. I just think hospitals have been burdened with regulatory requirements and other things where they've been busy and they have not had the time, energy, and resources to actually itemize services. I mean, it's pretty clear. Hospitals have, instead of, say, in most businesses, itemize the cost of an individual service, hospitals will just look at total revenue and total expenses and try hard to stay on top. But we need to know exactly how much a service, an infusion therapy, an operation cost, and we need to price that fairly. And what I love about Keith Smith in Oklahoma is he charges the same amount, regardless if you're paying out of pocket or if you're an insurance company paying. One fair and honest price. It's not the lowest price, but it's a pretty darn good price, and it's fair and it's honest, and it is eliminating that middleman repricing industry. Think about all the money we spend hounding people for payments and fighting insurance companies on the hospital side, and insurance companies fighting hospitals on pre-authorizations and peer-to-peer approvals. This is the stuff that drives us doctors nuts. I mean, the pre-authorization, the peer-to-peer, it's like, let us just do our job. I don't believe doctors are lazy people. We just don't want to spend our time on things that don't matter. And it's like, let us take care of patients. So some of these hospitals that have been egregious in their predatory billing and price gouging, shaking people down in court, trying to garnish their wages to the point where half the town has been sued. These are low-income working Americans have been sued to have their paychecks garnished by their local community nonprofit hospital. I'll go in there with my advocacy group, and we will offer to provide free representation to the patients getting sued. I mean, this Friday, we've got 340 patients lined up at the docket where the hospital is suing them to have their wages garnished. And we're going to go in there and we're going to defend them. Now, I can tell you, every time a patient agrees to let me put my name